of this gathering is to let the government know that enough is enough, and no way we as workers together are going to take any more of what they are doing to us. We need to have solid foundation in our working place. We need to have benefit. We need to have good wages. We need to get respect and recognized. Slavery is no more in this world anymore, and Canada will no more tolerate it. And we as LKRA together, we are going to fight for the dignity and the rights of all the clients and the workers in the workplace, and more than all, for the resident that work so hard to achieve quality living.
This government promised to put standards of care in Bill 140. We have called for a minimum of 3.5 hours. The residents we serve deserve 3.5 hours. And we're not going to stop until each and every resident in each and every long-term care facility gets 3.5 hours of care, hands-on care. If they won't take us to a chronic care level, off the bat, we're not going to stop until they say 3.5.
Sisters and brothers, we're in the great city of Windsor, and we can see Detroit, a great working class town, but we know 40 million Americans have no health care coverage. And for those in Canada that want to experiment with privatization, we don't ever want that system. We want a fully public Canadian system where the size of your wallet doesn't dictate the quality of your health care. Fred is right. This is a national debate. Yours is the 10th province to meet in the last 15 weeks in our great union. Every CUPE convention is debating health care. 2 nights ago, in my home province, the Tories ran an election campaign and made 2 critical mistakes. 1, they said health care wouldn't be their #1 priority. And 2, they said privatization options had to be looked at. What did the citizens of Manitoba do for the 3rd consecutive time? They returned an NDP government who said public health care is #1. And that NDP government has 2 CUPE sisters elected, 5 more women, 13 out of 36 MLAs, women putting health care front and center in the province of Manitoba. So your debates this morning and the debates you have in the next 2 or 3 days will talk about McGuinty and Ontario. But we need your voice to help out the citizens of British Columbia, where all new hospitals must go through a P3 screen. We need your voice to say to Mr. Harper, don't tie federal investment in healthcare to P3 campaigns. Mr. Harper, you have a minority government. You can be replaced. The citizens of Canada want public health care now. We want a national pharmaceutical plan. We want improved health care for all Canadians.
To Sandra Pupatello and to Dwight Duncan, cabinet ministers in the McGuinty government representing Windsor, complicit in the introduction of a market into the healthcare system which will commodify services, which will introduce privatization. We're here today, sisters and brothers, to say that the healthcare membership of CUPE, which is 70,000 people in hospitals, long-term care, community care, and home care, pledge that we will not allow this system to close or privatize services, that we're going to alert citizens in smaller communities like Leamington, just outside this city's borders, whose rural hospital will be threatened as a result of the consolidation of production that's going to occur in medical services by virtue of this market that they've created. That we're going to fight you in every one of these communities. We're going to mobilize northern, rural communities. We're going to mobilize the citizens of Windsor against any proposal which would cut or privatize or transfer to the private John Tory, the leader of the Progressive Conservative Party, that we have noted his commitment to transfer day surgeries to privately owned and operated surgical centers. Citizens of Windsor, we don't believe the citizens of Ontario are on board with the creation of a healthcare system that looks like that one, where death rates are from 2 to 7% higher in their hospitals because they skimp on blood cleaning products and on professional staff so that they can enhance profits for shareholders. We reject that healthcare system.